Good afternoon. My name is Marcia Diamond, and I'm the New Business Development with OliaServe. And thank you for joining us for our February webinar today. OliaServe has been the sponsor for these educational webinars. Some housekeeping tips, the PowerPoint slideshow and the certificate of participation will be available next Wednesday at www.oliaserve.com. You'll have to go there and download the certificate. The other thing is you can hashtag OliaServe webinar, tweet out information. We have a raffle going on that people will be entered into an entree for $25 for Amazon. Thank you. So today's webinar is called Create Value with Your Current Hospital Resources. And today we are lucky to have Michael Attanasio, Director of Food and Nutrition Services, Patient Transport and Metabolic Program at Overlook Medical Center, New Jersey. Michael Attanasio started his career 33 years ago in the hospitality industry. His healthcare career started in 1989 at a large multi-site medical center in New Jersey. He currently manages food and nutrition services, patient transport, and a metabolic program at Overlook Medical Center, a 525-bed acute care facility recognized by U.S. News Best Hospital as one of the best regional medical centers. Michael has received a number of industry recognitions and sits on several state and national boards, including the Gold Star Advisory member for the General Mills Advisory Board. He's been a handful of participants selected nationally to participate in think tanks such as the Future Rectors Magazine, In Front of the Future Summit, Monsanto's Food Biotechnology. He has also written and contributed to newspaper and trade magazine periodicals and has conducted numerous workshops for national and local conferences on topics such as customer service, retail marketing, management, competency, finance, culinary training, and operational efficiency. Michael, thank you for joining us today.
Thank you.
I want to make sure that everyone is on mute except for Michael. And Michael, you are on the phone call. Your computer audio has been, your dot is on the phone call, I would correct, right?
Correct.
Just to make sure. Okay. Great. Michael, thank you for joining us today. And today is Create Value with Your Current Hospital Resources. Our objective today is understanding how to utilize economies of scale within your operation. You're going to be able to comprehend doing more with less, but still execute improvements for customer experiences. And you're going to learn 2 strategies for negotiation for the equipment and or renovation you need in your operation. So, without further ado, I'm going to hand it over to Michael.
All right, thank you very much, Marcia, and certainly thank you for the opportunity to share a little bit of my experience, both in the industry and here at Overlook. And thank you all for attending. Hopefully, you'll get a little bit of something out of it. Again, you know, the first slide, why are we here? It's kind of, you know, how did we get this in this particular point of time? And I'm sure everybody is very much aware of the Affordable Care Act and pay for performance. This is a little quote, really kind of the intentions of President Obama on what he was looking to do in healthcare. And then, of course, Joe Biden. I will spare you the expletive, but he had his own little choice words to say. All right, I am flipping ahead. Sorry about that. Okay, so I wanted to add a couple slides on healthcare reform because it speaks volumes and certainly is one of the key contributing factors to why we in healthcare now are asking to do more with less, and not to reiterate the cliche. Many years ago, and I'm assuming many of you probably have been in the industry for quite some time, many years ago, pre-pay for performance, pre-Affordable Care Act, organizations really had the option of focusing on mission or focusing on margin. Now, through the transitions of healthcare and a lot of reallocation of funds, and in some cases elimination of funds, it really forces organizations to focus on both mission and margin. So reimbursable dollars through Medicare and Medicaid are really tied directly to performance. The Affordable Care Act also brought a significant change in terms of the dynamic, and the three major goals for this legislation was to replace costly fee-for-service, improve healthcare quality, and achieve universal healthcare coverage. So really the driving force of this is to revamp both the delivery of care and the access to care. Down below, there's a few important dates, milestones, if you will. So the Health Information Technology for Economic and Clinical Health Act, Patient Protection and Affordability Care Act, and then the Medicare Access and CHIP, or what's known as MACRA, which is really significant change in terms of how physicians get paid. So here we kind of have the three big bubbles, if you will. IT-powered delivery system, and this was a mandate from the federal government. And again, for many organizations, this put a significant cost or expense burden to move to electronic medical records and significantly increase the level of technology that healthcare organizations use. And it also was a big lift in patient care. Certainly it created synergies in organizations. Rigorous scorekeeping, again, all of the quality measures. And for all of us on a call here, you're probably well aware that the pay for performance far exceeds just is the patient happy here. There's hospital-acquired infections and a lot of other mortality rates and a lot of other things that really kind of push organizations to provide healthcare in a much more careful manner, and certainly from a patient safety perspective. And public transparency. And public transparency, I think, is equally impactful in terms of costs, reimbursements, and expenses, revenue. There is a site, it's Hospital Compare, it's a government website, and it gives transparency to patients, and now patients, you know, for lack of a better word, are really consumers. So when you kind of tie everything up together and you look at, you know, now HCAHPS spits out, for all intents and purposes, a star rating, 1 through 5, and you input into that mix the transparency that consumers have. It's really pushing us in healthcare more into a retail type of an environment. Star ratings are very similar, obviously, for hotels and all these other things. So consumers now, to a large extent, have a choice. If they see a facility that maybe has better cost structure or higher safety ratings or all of those things, it's gonna change the way they think and certainly push them to one particular organization or another. Moving from service to a different type of payer method. Bundling has now become part of our world and will continue to do so. So in very simple terms, where there was a fee for service for unilateral joint replacement, there's a fee for anesthesia, a fee for this, a fee for the hospital, a fee for alternative level of care, and so on and so forth. Now, there's $1 amount that is sent and issued to cover the whole continuum of care. So that money is divvied up while the patient is in the hospital and post-discharge, whether they go to an alternative level of care or home care. And again, the significance of that is that it ties into to the overall idea or concept, the reality that more and more resources are being pulled out of healthcare. As a general comment, I mean, there's large academic organizations which have little different issues. So this kind of all puts us into the ever popular cliche of doing more with less. So again, I understand, having been in the industry for a number of years, food service and food nutrition is very dynamic. It's never a case of one size fits all. There's always a uniqueness. So kind of rolling through some of these slides and the information and the content is really to give everybody an opportunity to possibly revisit something you've tried, to possibly give you some new information to take back and play with, or just to give a little bit different perspective. So this isn't certainly a panacea. Again, all of these things that we're going to go through today, I think, will function and work and help to one extent or another. But there is an awful lot of uniqueness in healthcare organizations. So benchmarking for success, you know, why is benchmarks important? What is a benchmark? Why should we do it? Benchmarks that I have here serves as a standard by which performance can be measured. So benchmarks are not the live or die by, but benchmarks will give us, the operators, a really good indication of where do we stack up to our peers or our colleagues. Benchmarks are, you know, can be a number of different things. I would strongly encourage anybody and everybody who has access to external third-party benchmarks, whether you've been asked to do it, whether you've done it in the past, I would encourage everybody to start benchmarking. And again, it's a performance indicator, so you can compare your facility to others like yours, and you can do military, non-military, cook serve, room service, bed size, and so on and so forth. So it kind of gives you an accurate kind of overview of, yeah, I'm where I need to be, or no, there's a gap, let me take a look at it. And again, benchmarking is really just comparing one operation to another of likeness. So, you know, what should we benchmark? What can we benchmark? And again, benchmark in and of itself, there's an awful lot of things. There's clinical benchmarks, non-clinical benchmarks, employee engagement benchmarks. Some of the common / critical that I feel, and I certainly have done throughout my career, things that tie to patient satisfaction, so temperature of food, courtesy of tray passer, quality of food, and these are typically things that are going to be found for those organizations, and I'm assuming most do, use a third-party Press Ganey, Jackson type of a survey to solicit feedback. That in and of itself is a benchmark because it does, excuse me, certainly can compare your performance to others, and I know all of the surveyors, third parties, you have an ability to either look at, you know, bed size or by state. So that in and of itself, again, is, and I'm sure I don't need to tell anybody on the call about these types of things. I'm sure everyone's living it. The cost, you know, looking at benchmarks that really tie to cost structure, and this is kind of a pivotal point as well, because it will give you a good indication, and again, part of the goal of this presentation is kind of looking really for utilizing resources and getting and optimizing what you do have, and in some cases what you don't have. So floor stock cost, nourishment cost, cost per patient day, cost per meal, these are great indicators to say, yeah, you know what, I'm operating pretty lean, or there looks to be some room for opportunity, and then dig a little bit different. And you know, oftentimes, and at least in my experience, I do not work for an academic organization. We rely heavily on Medicare and Medicaid and other sources. We don't have a wealth of resources that I can say, yeah, I want to do this and let me do that. Oftentimes for me, it's a zero-sum game, and it may be the same for you as well. So if you want to spend $6,000 more here, you got to find $6,000 elsewhere. And these are all, again, kind of pivotal points or leverage points, I should say, and in my particular experience, that I can do creative things and look to do things a little bit differently and do so at a net cost break even or budget neutral perspective.
Michael, before you go to the next slide, could you give an example of at your facility that you allowed you to execute some improvement based on what you resulted from benchmarking?
Oh, absolutely, and there's dozens and dozens, and I will give you a very simple one, and I will spare my own opinions on some of these things. You know, a lot of what we do in retail and with patients is driven by the consumer, and a lot of what the consumer looks for, whether it's a trend passing or not, is what they see on TV, what the flavor of the month is, so to speak. So, organic products, antibiotic-free products, gluten-free products. These are things now that consumers look for, whether we agree with it or disagree with it. They come at a premium, and sustainable products, you know, paper goods that are compostable. So rather than just say, I can't do this because it costs me $12,000 extra a year, I look at a descending dollar report and say, is there an opportunity that I can save this money elsewhere? There are dozens and hundreds, and I will give you two simple examples, and some are a little bit more complex. We found a sausage patty that we were serving throughout the house. It was the same size in terms of dimension. It was flattened out and designed to be a little bit, cover a little bit more of the plate, and it was a ½ ounce or 3/4 of an ounce less. So when you look at the proportion cost, or I'm sorry, the portion cost, it was much less. We looked at things, you know, low-hanging fruit things. We looked at the slice count for American cheese. American cheese is priced per pound, so if you can get a higher slice count and still make it, you know, passable, you can save money there. We looked at, in some cases, frozen vegetables were cheaper in bulk, and in some cases it was cheaper in the 6 3-pound bags. So all of those things we look and we pick a little here and pick a little there. And, you know, for most of us, I'm assuming, you know, we're not going to find one big thing, one smoking gun to say, oh, I can save 20,000. But, you know, there's an old saying, I think it was Ben Franklin, mind your pennies and your dollars will take care of themselves. So I was able to invest a little bit more in some of the organic stuff and antibiotic-free, and I was able to do so almost at a net cost or a budget neutral perspective because I saved the money elsewhere. You know, looking at doing plate wastes, gearing your menu for those who maybe cook serve or even cook chill or pods. Well, pods are a little different, but, you know, gearing your menu to reduce waste. We have a very talented retail coordinator here. She coordinates all of my waste studies throughout the department. So these are one of many, many measures to kind of look to save on the left, to spend on the right, to increase value. And then, you know, looking at hard and soft revenue that influences the department's net cost. So many departments, not all, in my particular situation, what we make in the employee cafeteria, as an example, comes back and nets off of my costs. So if I can look for things, use technology, whether it's a POS system, to push more volume towards the higher margin items, it's going to help me overall, and it's going to help offset some of my other costs throughout the department. Check average, revenue per day, per patient day, revenue per meal. That will also give me an indication of how am I doing compared to others. We have a sister hospital that's a little bit larger than us. And I was speaking with the gentleman in retail, and he goes, wow, you know, my revenue has gone up 2%, 3%, 5%, 4%. I said, that's great. I said, how did your patient days go up, and how did this go up? And I meant it facetiously, but looking into it, really his patient days, and, you know, patient days on the retail side creates revenue because of visitors. It went up exponentially. I mean, it went up probably 10, 12%. So one could argue well, you really didn't optimize your clientele. So, this, looking at benchmarks again, kind of zeroes you in, and it gives you the ability to say, yeah, my revenue went up, but you know what, my patient days went up an awful lot. So maybe I could have, pushed the envelope, did bundles or something to drive volume. The productivity for the department based on either meals or productive labor hour or productive hours per meal. These are ways, and you can do it for clinical and non-clinical, to kind of look at the dietitians from a productivity perspective. And productivity translates out to output, or throughput, I should say, and throughput translates out to really patient experience and patient care. Quicker we can get to a patient, whether it's on the meal delivery side, on the clinical side, the better and safer it is for the patient. So, looking at some of the clinical benchmarks to assess our labor, and I'll speak a little bit later in this as to some of the functions or the uses of benchmarks. All of this stuff kind of is multifaceted and can be used in so many different ways. Again, I'll get to in a moment. Employee engagement, again, employee engagement. Some folks or some organizations, I should say, use an outside organization to do their employee engagement, but these can be considered benchmarks. On a side note, whether it is or whether it isn't, having an engaged employee ties into everything else that we do in terms of quality, both on the revenue and retail and patients. So again, why benchmark? So benchmarking, and I kind of put a few things in here, and I can tell you benchmarking is just invaluable and can be only limited by one's creativity and use for it, I should say. So operationally, again, it gives us as operators a measurement of performance. And oftentimes, and I've spoken a few different times throughout the country and certainly here in the Northeast, and it always kind of astounded me when I hear people say, nah, nobody's really bothered me about my expenses. And, well, I've been here for 10 years, 15 years, 20 years. It's a very, very different time and place that we live in. And again, the impact of the ACA and ACOs and HCAHPS has just been so profound. Not the least of which is, forming ACOs. Now everyone's competing a little bit more, and there's, particularly here in the Northeast, where many years ago we were kind of overbedded per capita. Now it's forced acquisitions and mergers. So, it may take a little bit longer to hit some organizations than others. Some organizations may be a little bit more heavier endowed than others. But I've always made it kind of a fundamental practice that I never waited for my boss to come in and say, I need you to save money. Or I never waited for my boss to come in and say, oh, we have a consultant coming. And it's really just, and I put here competitive advantage, it's really just staying proactive. And this is going back years and years and years. When I had, and I've worked in some places that were feast, and I've worked in some places that were famine. And even in the feast places, I always, if I had a position opened, I always scrutinized it. Do I really need to do this? Can I centralize production or something? And I'll talk a little bit more about that. So as an operator, it gives us a pretty good handle on measurement performance. It actually forces us to have a good handle on our numbers, our operation, the activities. Again, where are our strengths, where are our opportunities? And it helps us to focus on best practices and peer sharing. So it can be collaborative, certainly, and I understand there's contract and non-contract organizations, but nonetheless, it really gives us an opportunity to scrutinize and look at best practices. And again, if a benchmark for floor stock is $1.45 per patient day, and I'm at $1.75. The reaction isn't, oh my God, I got to save money. The reaction is, well, if there's a gap, let me take a look at it. Maybe we have more doctor's lounges, or maybe we do this. So it's really just an introspective and an objective look at the operation. Financial, I can speak for hours on how this has benefited me. from new CFOs coming in and saying, well, you know, I see you're asking for this, but what are the benchmarks? And I was able to shoot it off to them. So again, you know, I think it's incumbent on food service directors, certainly expectation of our administrators, that we have a good idea of our department and the numbers in it, because resources are getting scarce and scarce, and it's oftentimes a discussion or a decision. Do I give the money to food service, or do I put it into another nursing unit or imaging or something like that? It also develops and supports cost reduction strategies or new initiatives. So if there is a need to reduce costs, we can see opportunities and find opportunities through benchmarking. If we have to fund or would like to fund a new initiative, whether it's labor or non-labor, benchmarks will give us the opportunity to kind of look deep and take a deep dive and tease out some of the granular aspects of our department. And it gives us, you know, access to metrics and all those great things. I use it for for budget preparation. So I do my budget, I do a pro forma as though my department doesn't exist using benchmarks, and then I look at my run rate. And then I add into that assumptions, and if there is a gap, then I do a gap analysis. And, you know, it takes a little bit more time, but I've always found it well worth the time, because I've sat through a number of budget meetings, and our budget meetings is I sit in front of a panel of administrators and finance, and they grill me, and never have I been in a situation where I couldn't articulate a reasonable and sensible explanation for my request. They didn't always give it to me, but I'm sure I got far more simply because I was able to explain it in a way that it made sense. You can use it for variance explanation. So many organizations may do variance reports. We do here. So if there was a variance in any one particular area, whether it was food or labor, I can use this to either for myself to say, well, the variance shouldn't be there, or the variance here is there, here's why, and then speak with my administrator and say, these are the pros and cons, give me the call, give me the direction, do you want me to stop, assist, cease to desist. So, and here I, you know, to kind of manage by the numbers, but as a general consensus, you know, it's difficult doing what we're doing, and, you know, I've put here kind of facetiously, you know, it's a very delicate balance between pessimism, optimism, and realism, simply because we can't always say to our administrator, yeah, I'll do it, and we certainly can never, or can't always say no. So it's a delicate balance to kind of really push the envelope to optimize what we have, push quality, push all the synergies and things like that. And, you know, sometimes it's a question of educating your boss when they want to do project A. Well, you know, here's why we can't do that, but here's an alternative that we can do. And again, you know, what we do is not difficult. So I love numbers. My life runs on numbers. Numbers are finite. Numbers don't lie. People may, but numbers don't. And numbers, to me, I understand and can read subjective things better if it's through numbers. So just, and again, the purpose of this is to kind of give you a few takeaways to say, you know, maybe I'll try this, I'll try it on a small scale. And, you know, oftentimes, even if you start out small, there'll be value in it, as opposed to trying to do everything and failing at everything, or you know, if you start out small with some of these exercises. So a labor analysis, or an FTE zero base with a non-productive rate. And Marcia, you had asked the question, and I think I had given you more of a food or supplies related answer, but to answer your question relative to this exercise and with labor, I had to reorganize, or wanted to reorganize, my department to bolster a little bit more of leadership, realign some of the functions, and at the time I wasn't able to get any more labor. And before I ask for labor, I make sure, absolutely, that I need it. So I zero-based my department, and zero-basing, and there'll be an example next, and I'll show it, is kind of not people, but by position. So tray passer 1, 7 to 3, Monday through Sunday, how many hours? And doing that right on down the line with all the laborers, all the positions, you tally it all up, and I put here specifically non-productive rate because it is important to add in a non-productive rate. So optimally looking at your actual run rate for non-productive rate. So you tally up basic needs, zero base for staffing, add a non-productive rate. In my case, or in most cases, it's 10%. If you're union, it's probably closer to 13 or 14. And then that spits out how many FTEs you have, or need, I should say. Then you compare that to how many FTEs you have. And, you know, you may be over, you may be under. And I had done this as an example, Marcia, to your question, with my supervisory staff. And I actually had one other position that was, I'll use the word expendable, but I was running one other position above what my staffing zero base told me I needed. I was able to take that and reclass that into this higher level kind of managerial type position. This is invaluable when I do my budget, and I use it to say, okay, this in conjunction with benchmarks. So it helps me identify and it helps me explain and push and all these other things and support initiatives, operations, and all of the things that we have to do. Looking at centralizing functions, you know, when I had gotten here a number of years ago, there was, in a simple example, there's 3 or 4 different people slicing cold cuts. And this kind of comes from a task analysis of breaking out what does every position do. So simple, okay, well, you know, can we have 2 people do cold cuts or 1 person do cold cuts instead of 4 different people slicing for different operations? Soup, sauces, gravies, a lot of the production part of that. And again, it's looking for efficiencies and streamlining our operation in terms of tasks. Compare year-over-year trends. Again, you know, looking at your current operation, looking at prior years in terms of your operation. Did you go up or down commensurate with some of the either benchmarks or just hospital operations? Did patient census go up? Did patient census go down? With a lot of the changes in healthcare, all of the changes in healthcare, it's really pushing a migration or forcing a migration from inpatient to outpatient, and you know, it hurts, or I should say it impacts financially, but from our operational perspective, to what extent did that happen? Did it happen? And should I be looking at maybe changing service models for patient feeding or, you know, my clinical staff? Other efficiency measures, trays per minute, tray accuracy. Tray accuracy, you know, people think of it as a patient experience thing, and it most certainly is, but it also ties into time, or productive time, or non-productive time, whatever you wish to call it. So if a tray is not accurate, how many people and how many steps are involved to fix that? Get it right the first time, and you're saving that downstream labor. Trays per minute, are you running at 2, you know, and again, it's going to be trays per minute. It's certainly going to be different with room service and pods and traditional tray line. As an example, with a traditional tray line, are you running 2 trays per minute? And you should be probably closer to 4 type of a thing. And then looking at all of the contributing factors to that. Look at technology for cost savings and efficiencies. And now, I guess I have the benefit and the detriment of being around long before internet and the microchip and stuff like that really kind of hit the public sector. It pretty much now with technology, if you can dream it or you can think it, it's probably out there. And nowadays it's out there at a much lower cost than years prior. So many different examples of this: a POS system to barcode scan as opposed to ringing everybody in, touch screens, digital marketing and signage instead of having somebody physically do it, print it, automated temp monitoring system instead of having somebody manually collect. And to be honest with you, using that as an example, I mean, they are I mean, literally from mid to larger size hospital, a few $1,000s, 5,000, 6,000, you can get a functional automated temp monitoring system. So the point is really to kind of leverage your technology in kind of conjunction with reallocating those resources to maybe embellish something in retail, embellish something for the patients, or embellish something in one or you know, catering for those of you who generate revenue. So again, and I'll probably say this a few times and reiterate it, the point of this isn't to say save, 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 save. The point of this is to say, okay, you have block A in terms of resources. How can I really push the envelope, get creative, use technology to get the most out of this? And again, I mean, you know, there's online ordering systems, there's platforms called Tabbed Out. People can order online, pay online, get out, and it helps in a number of different ways, and then you can upsell. This I had mentioned earlier. I think this is invaluable, and I've saved a lot of money year over year over year. A descending dollar report, and you know, you can even just pull out some of the low-hanging fruit stuff. Effectively, what a descending dollar report is it's a report of all of your food purchases by dollar amount, not by product cost. So you can have filet mignon, but it can be on the bottom of the list because you spend much more in terms of quantity on turkey breasts. Where that's invaluable to me is it gives you a whole list of, you're buying this product, this many cases, average cost by case, and you can pick stuff off. You know, I use the sausage example or the cheese. Turkey breast, can you get a, you know, equal quality but maybe a different breast? You're saving 4 cents a pound, you're doing 2 tons a year, that type of stuff. You know, this, and again, everything that I'm kind of going over isn't to do this or this. These are all kind of run in tandem or tantamount to each other, where, you know, this in conjunction with looking at some of your productive methods, looking at plate waste studies. You know, if you have a breadstick on your plate with lasagna or whatever, and it's constantly getting thrown out at the dish machine, well, take it off or substitute it. So descending dollar report, I can't recommend enough. And a lot of times, if you do not have access yourself, your sales rep can certainly get that for you. Triage priorities and invest in those that give you the biggest bang for your buck. And I will not share my personal preferences or opinions, but, you know, organic chicken, or I'm sorry, antibiotic chicken, organic, green initiatives, these are big, and they'll continue to be big. Healthy initiatives are big and continue to be big. And I think we have to be cognizant of the fact that our consumers are all experts now. All of us on food TV, the internet, everyone's an expert. And again, I'm saying that tongue-in-cheek, but everyone, a lot of folks get their information from the internet, from the commercials, from this and that, and it may or may not be accurate, or it may be out of context. So, different topic, you know, we need to educate them a little bit, but nonetheless, you put organic on something and people will buy it. You put antibiotic on it, and antibiotic-free, and I should say antibiotic-free chicken, but you know, gluten-free. There are those with celiacs and other intolerances to gluten. Got it. It's important. But there are many, 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 many who see gluten as healthier. Gluten's a protein. It doesn't help or hurt unless obviously you have celiacs. And although there is a little bit of science between correlating that to an inflammatory type of process, but nonetheless. So triaging your priorities. Would we love to do all of these things? Absolutely. Paper goods, sustainable or compostable paper goods are really, really expensive, although they're coming down a little bit. So utilizing some of these other exercises, freeing up some resources to invest in these things are important. And then triaging them. You know, can I do organic and maybe not the antibiotic-free chicken, or can I do more on this reduced or reduced sodium products or less on this? It's a little funny story, and this is it's kind of tongue-in-cheek, but I had a sales rep pushing antibiotic-free chicken to me for the patients and this and that. So I said, I tell you what, answer me one question. and I'll buy all the chicken. If you can answer me a question that makes sense, why should I pay an extra $1.50 a pound for antibiotic-free chicken and feed it to a patient who has a bag of antibiotics being pumped in their system? So I mean that facetiously, but you know what? If I have the resources to do everything, God bless, Godspeed. If I don't, I'll invest more in green initiatives, more in sodium-reduced or eliminated products, more in some gluten-free stuff, or you know, other specialties. And I hope that makes sense. And again, you know, if you can't do full boat, do some small stuff. And we've made some small changes with kind of one-off products that were reasonably close to our costs in terms of clamshells and some of the other paper products in the retail outlets. And we were actually able to do antibiotic-free chicken. There was a product that came out, and it wasn't a whole boneless breast. It was other different types of products. We were able to do combination dishes with it, and so on and so forth. So waste tracking, again, our retail person, she does the waste tracking, and I tell you, it speaks volumes. Many years ago, and some of you may recall, you know, it used to be, well, your garbage cost $1 a pound, so you weigh your garbage cans and you try and save it. But, you know, putting in a waste tracking, and even again, if you can kind of start small or some key areas, you know, there's some bigger ticket items, protein salads, protein center of the plate type stuff, and even the smaller stuff adds up. So, again, you know, plate wasting will give you an idea where your money's going. It's either going to the patients, the consumers and retailer, to the garbage. And I'd mentioned, not to be repetitive or redundant, but understanding and analyzing the gaps between where you are and some of the benchmarks. So this is a quick example. I know you cannot see it well, but I kind of highlighted or magnified a couple of the key sections. So really on the left, it's your positions. In the middle, it's, okay, this position works from 6 to 2 or 7 to 3 or whatever your hours may be. And then the little magnified section to the right, it's 7 days a week, 5 days a week, and then it spits out hours. Total it up, add your non-productive rate. That's where you should be running at. That's where you should be budgeted. And if you're not, again, take a look at it. Do I have casual time? Am I under budgeted? Am I over budgeted? And you know what? I'll reclass those hours to do something with patient services. So again, that's kind of looking at your numbers and looking at your department, moving more into some strategies and capital improvements, and that can be big, that can be small. I show you some simple examples, the picture at the bottom there, and that's, you know, again, we kind of took some graces. That's almost the same thing as what's here on this plate, on this tray. It changed the tray, it changed the plates, it changed some of the containers, and most of which, to be very honest with you, was cost neutral. Some of the disposable stuff, we went to reusable stuff. Yeah, we have to run it more through the more stuff through the dish machine. That can also tie to a green initiative. So again, I understand not everyone's going to have a glass, but you know, for example, the juices, we moved from a carton juice to a juice machine and put it in a clear plastic cup. Some of the disposable stuff we either put on a plate with a snap lid, or we used a reusable product. So, you know, when do we look to and why do we look for capital improvements? You know, a lot of time equipment has either exceeded its useful life, or just is to the point where it's either not repairable or costly. So oftentimes I'll do an ROI, and I'll let my administrator know, look, this thing cost me $6 grand and I'm spending $5 grand a year to replace or to repair it. We need a new one. And I already kind of mentioned the simple changes in tabletop components. So,
or even in starting a tray line, you talk about waste, time, and energy. So starting your tray line, having it more strategic the way you start it, so that food gets up hotter as well. I would say. Correct.
So there's a picture here of a piece of equipment that will be at the starting station, and this ties into a lot of other things I had mentioned and will mention in terms of efficiency, having everything in one location, having everything accessible, Instead of reaching left, right, top, bottom, it's all there. Things like this also are significant in terms of increasing trays per minute. Increased trays per minute is increased patient satisfaction, and in some cases patient safety. Again, the pictures, I understand juxtaposing the two pictures, one's the extreme to the other, but the point is you can change a tray, you can change one or two things, and it really kind of significantly increases the look. And pictures are great when you're pitching stuff that costs money to administrators. And then using things like cost of repairs or replacement, and you do an ROI. So $6,000 to buy a new one, $4,000 in repairs. Do the quick math and say I can pay for this thing in a year and a half. I'm trying to flip my next screen or my next slide. Oh, we're there. Okay. So again, up top, this has a number of applications, more retail, the piece of equipment there, but this is also an example. So some of the reasons why we want to make changes is to look for things that are more efficient, more ergonomic, and then you can again tie in if there's a labor savings or even a reallocation of labor. It doesn't necessarily have to be if I buy this, I'm going to save an FTE. If I buy this, I can reallocate this FTE to patient experience, to sanitation, to this, to that, the other thing. So it's really kind of painting the picture in terms of selling yourself and selling your administrator on the idea. Ergonomics is great. You can look at, employee safety, and if there's an organization that may have downtime due to work-related injuries. Obviously, if you're looking at an alternative patient menu, patient service model, bedside menu entry pods, room service. Again, to pitch it, look at cost benefits, look at efficiencies, look at patient experience benefits, which are hard to sell. It's great to say, well, geez, my patients will be happier, and you tell your administrator that. How do you quantify that? And the way I quantify it is I look at some of these other costs and food costs and labor, and oftentimes I'll use some benchmarks, and you can even delve deeper to say this person does room service, similar hospital, and these are their patient experience scores. Although that may be a little bit more difficult to get, you can tie that into your sales pitch, both for reasoning to change and explanation. There's a lot of new equipment out, a lot of new technology. I know Marcia AlioServe has a ton of stuff on the market and new stuff coming out that can increase efficiency through quicker production. There's turbo chefs and all these other great things. Increase quality of food, maybe staging areas on patient units or staging areas in retail. And there are times, if you dig deep and look carefully, there's equipment that can help you kind of utilize common ingredients, which will reduce waste and reduce inventory costs. And for most of us, not all of us, some organizations and contractors do account for inventory, and there are some of us where inventory, if it's sitting on the shelves, it's really a cost to the organization because it doesn't net off of a P&L or so on and so forth. Sorry, the slides are a little sluggish, or maybe I'm sluggish. All right. So I mentioned a spaghetti chart up top. This is a very simple spaghetti chart, and it sounds kind of ridiculous, but it's a real thing, believe me. So basically what a spaghetti chart is you kind of take a look at, and it can be as sophisticated or simple as you like. For example, with patient feeding, what's the process that it takes to receive food, from the point you receive food to get it to the patient? How many steps are there involved? So you can see the before, you see all these lines, and I had examples that show much, much more. So some justification for or strategies to get approved capital improvement is to say, look, this is kind of what we're doing now. If we build out the kitchen or change the pods or change to bedside menu entry or change this or change that, we're going to simplify tasks, we're going to increase flow, simplify movements, and all of those types of things. Some people, there's software that does this. I know people that just kind of penciled it out and kind of just thought of it from a data perspective. And oftentimes you go in your kitchen and there's everyone's busy and so on and so forth, but if you look at it from a substantial or data perspective, it can give you a much different picture. Again, I apologize, the slides are, I know we're nearing the end, so I kind of want to go through these. You know, capital, usually organizations, and the rule of thumb has changed a little bit, organizations will usually invest the appropriate or proportionate amount into the organization that they pay in depreciation. Point is there's always capital available. You know, is there a priority?
Could you say that again, Michael? Michael, could you say that again?
Sure. The overriding point is there's always capital available. And the rule of thumb for organizations, not just healthcare, is they invest in capital the same amount of money or proportionate amount as they pay in depreciation. So again, there's going to be money available. You know, I get it, I understand. Will it go towards expansion of new nursing units or new beds as opposed to ovens? Very well may be. But the point is to really kind of build a case. And it's not just to get it approved. It's really taking a look at your operation and thinking differently, thinking creatively to say, I'm going to do this patient service model, I'm going to build it out, and then you use all of these numbers and exercises to plead your case and get it approved. Most importantly, that I had found, and again, you use patient experience and staff engagement and all of these things, is when you look at these ideas, don't think in terms of restrictions, and I can tell you countless stories, and I'm sure many of you on the phone or on the webinar can as well, that, you know, well, I can't do this, I don't have the labor, or, you know, I can't do this because it's going to be too much money. Throw it out there, and you know what, if you ask for nothing, that's exactly what you're going to get. So don't plan with restrictions in mind. Utilize visual aids and renditions to pre and post project to help sell the idea, and then identify the value that it's going to bring. And it could be something simple. I mean, we have an idea for our cafeteria. We have something that's kind of in place. It's been there for years, and it's very simple. We can pull it out, put a couple other things in, and it's really not even a big capital expense. So, sorry, my slides are...
Michael, before we go, question came up. What kind of visual aids do you use to make a difference to your C-level?
One rule of thumb for me, and I've heard this from other administrators and certainly in my experience, you want to kind of keep it as simple as possible. So you don't want to go with a 50-page slide deck. I do a pre and a post. So if it's a kitchen renovation, this is what it is. This is what it will look like. And then you kind of build in the explanations. I do simple things actually, and I've done this a little bit less. I know people, if you have a piece of equipment that is well beyond its life, not functional, snap a picture of it and attach it to your capital request or speak to your administrator. And here's another good example. I put in for a replacement dish machine with some other features. It's $250,000. And I think it's important and incumbent on us to educate our administrators, because our administrators, with few exceptions, do not know food service. So when they see a capital request of $257,000 for a dish machine, they're thinking, geez, my Bosch at home was $1,000 or $2,000. So they can't always conceptualize it. So having visual aids, whether it's a picture pre, picture post, picture of a new piece of equipment, it gives them context and it gives them perception, perspective to really kind of say, oh, geez, it's not what I thought. You know, so in fact, that one picture that I had prior slides with the gal holding the tray, that was a picture that I built into a room service performer, or a room service proposal, and that's kind of, you know, it looks really nice. And it's striking when administrators looking at it. Keeping in mind, administrators know about food service either what you tell them or what their preconceived ideas are, and it's often tied to either a residential situation or their own situation or prior experiences. So again, you know, I put the quote on, you know, success is not, I'm sorry, Okay.
No, again.
Success is not final, failure is not fatal. It's the courage to continue that really counts. So, you know, we're all going to get shot down. I've been shot down thousands of times. It took me, I think, 5 years or so, 4 or 5 years, maybe longer to get my POS system, but persistence won the day. And also, and I mentioned this earlier, if you ask for nothing, well, that's kind of going to be what you get. So I do appreciate sincerely everybody's time. And certainly indulging me in kind of sharing some of my experiences. So if there's any questions, Marcia, I guess they can type it in.
Yep, they can type it in. And one question came up is, how do you decide which things that you should bring to the forefront? I mean, you must have a lot of initiatives, so how do you decide which one? How do you prioritize? Well, especially when we're talking about the day of customer experience, how do you prioritize? Is it more about the customer experience priority, or is it back of the house that's more efficient?
You know what? To be honest with you, it's going to vary site to site to site. The one thing I do not do, and I'm passionate about many things, and I pull my passion out of things, and I look at what, you know, I'll line up my ideas and say, this is going to be this benefit for this population, this is going to be this benefit for this population, and so on and so forth. And then I kind of triage it to say, you know what, the organization I exist in now, and this is a hypothetical, it's not the organization I exist in, everybody knows what is the hot topics, what are the driving forces at their hospital. If it is purely patient experience, then that's what you go with. And there's hospitals that say, you know what, we have X amount and we're going to invest it in patients. They're our prime directive. They're why we're here. So that's what you pitch. The other thing that I think is invaluable, and I would strongly encourage everybody to do it, put all of your ideas down, do a return on investment, say this is what it will cost, this is the benefit, and this is the population it's going to benefit. Put everything down, have a meeting with your administrator and say, where do your priorities lie? And I do that with everything. I do that when I'm asked to do cost reduction ideas or when I'm asked to do service enhancements. You know, again, I try not to think or act or pitch in a vacuum. I line up all my ideas, big and small, dollar amount, benefit, and what population is it going to benefit. And then I meet with my administrator and really, you know, the danger of not doing it that way is I may think project A is, you know, that's where the passion is, that's where the organization is, and I pitch it and there's, nah, it's really not, we're going to put the money into imaging. Well, it could be an opportunity lost because maybe had they seen the other proposals, they may really say, well, you know, really that's where I want to be. Because, you know, administrators can be funny and administrators have their own driving force and hopefully it's simpatico with the organizations, but you know what, they may want some bragging rights to do room service and, well, then you'll probably wind up doing it. So best case scenario, put all the ideas down, all of the information to make an informed decision and let your boss pick. It's kind of the simple way of saying it.
Somebody asked the question, is it always about the numbers or is it always about the numbers?
Well, you know, you can argue, and I'm not quite sure if they mean expenses or revenue or what. You can argue they're I'm sorry?
I was going to say we have less than a minute, so
okay,
just
real
to let
quick,
you know.
They're tantamount to each other. You know, it's the what comes first, mission or margin. So it's not about the numbers, it's about the patients in many cases, but guess what? The patients generate the numbers that allow you to provide for the patients. And and really it's a patient-centric type of a thing, but also you look at caregivers. So if those organizations have an employee cafeteria, you know, it's not about pushing revenue per se, although that's a part of it. It's really about taking care of the caregivers, and then that translates out back to the patients. So it's multifaceted. It's not just about the numbers, but all of the numbers of patient experience, quality, all these things kind of now.
All right, Michael, I hate to cut you off,
no
but
problem.
we have them on until 4 o'clock. Thank you, everybody, and if you have any questions, please email them to me, and I will forward them to Michael. But thank you for joining us today for the All You Serve webinar. And Michael, thank you for your input, and thank you for all your knowledge and really making a difference in your facility as well as all the other facilities and your employees.
All right. Thank you all very much.
Again, thank you. And Michael, thank you for sharing that night. If you have Michael's email address is on this PowerPoint, so you can give him connect with him directly if you need to, or you can send me the information. Again, once again, the certificate of participation will be available to download next Wednesday, as well as the video, audio, and hopefully you walked away with some strategies and also how to utilize economies of scale within your operation and really make a difference as you continue to create value with what you have and what you need to move on with. Thank you again. Have a wonderful afternoon. Again, my name is Marsha Diamond, and I'm with All You Serve. Thank you.
Thank you.